More people had a job in the Northstate in February compared to January. That's from numbers released by the State Employment Development Department today. Butte County's unemployment rate went down 0.1%, Del Norte down 0.5%, and both Glenn and Humboldt County's unemployment rate went down 0.3%. Modoc County's rate is down 0.4% from January to February. It stayed the same in Shasta County and went down 0.1% in Tehama County. The number of unemployed people is up 0.2% in Trinity County. Statewide, it's unchanged. The Department of Health and Human Services has announced more cuts as that overhaul of the country's health agencies continues. Here's Sinclair's Jeff Harris.
In addition to the 10,000 employees being cut from the FDA, CDC, NIH, and Centers for Medicare and Medicaid, HHS also announced it's consolidating from 28 divisions to 15 and creating what it calls the Administration for a Healthy America. Jeff Hammond, an economics and business expert, believes there are multiple levels to these cuts. First, the human level. Thousands of people losing their jobs.
It's certainly very difficult for the people involved. Let's not miss the human element.
But second, the overall macro perspective, as the U.S. is currently carrying over $36 trillion in national debt.
I'm actually at one level very encouraged that the administration is finally starting to deal with this problem of spending.
Among the cuts, 3,500 are from the FDA, 2,400 the CDC, 1,200 the NIH, and 300 from the Centers for Medicare and Medicaid. Reductions, the HHS says, will save taxpayers $1.8 billion a year. But Jocelyn Johnston, a professor of public policy, believes these moves will only end up hurting individual states.
States that have typically spent less on many public health programs, Mississippi, Alabama, Louisiana.
But more specifically, Medicaid, which millions of Americans enroll in.
1/3 of Americans are touched by Medicaid. They're receiving services through Medicaid.
From a legal perspective, Madeline Somerville, an attorney and political analyst, tells us these employees will have ground to stand on.
If you are a federal employee who's not a political appointee or a political employee, you do have protections.
Especially if there's what's called a reduction in force, because she says there are strict guidelines that govern the process of reducing an agency.
When you decide to get rid of those employees, you have to consider things like tenure or performance ratings or veteran status.
Now, the cuts Thursday come on top of the 10,000 employees who already voluntarily left multiple health agencies, shrinking the total workforce from about 82,000 down to 62,000. I'm Jeff Harris reporting from Washington.